Vitamin D deficiency overview. Vitamin D deficiency is a common issue affecting people over 65 and those with darker skin. It primarily affects bones and muscles and is preventable and treatable. Vitamin D is essential for bone development and maintenance, the nervous system, musculoskeletal system, and immune system. It can be obtained through sun exposure, food, and nutritional supplements. Chronic or severe vitamin D deficiency can lead to hypocalcemia, secondary hyperparathyroidism, muscle weakness, cramps, fatigue, and depression. It can also lead to accelerated bone demineralization, osteomalacia, and rickets, increasing the risk of bone fractures. It affects anyone, including infants, children, and adults, and may be more common in people with higher skin melanin content and extensive skin coverage. About 1 billion people worldwide have vitamin D deficiency, with 50% of the population having vitamin D insufficiency. Symptoms of vitamin D deficiency include incorrect growth patterns, muscle weakness, bone pain, and joint deformities. Vitamin D deficiency and its causes. Signs and symptoms of vitamin D deficiency. Mild vitamin D deficiency in children may result in weak, sore, and painful muscles. Adults may experience fatigue, bone pain, muscle weakness, muscle aches, or muscle cramps. Mood changes like depression may also be present. Causes of vitamin D deficiency. Lack of sufficient vitamin D in diet and sunlight. Inadequate absorption or use of vitamin D by the body. Medical conditions like cystic fibrosis, Crohn's disease, and celiac disease can prevent adequate absorption of vitamin D through supplements. Obesity, kidney disease, and liver disease reduce the amount of enzymes needed to convert vitamin D to a usable form. Weight loss surgeries can make it difficult for the body to absorb sufficient nutrients, vitamins, and minerals. Medications that can cause vitamin D deficiency. Laxatives, steroids, cholesterol-lowering drugs, seizure-preventing drugs, rifampin, and orlistat can lower vitamin D levels. Regular monitoring of vitamin D levels and other nutrient levels is crucial. Diagnosis and tests. Healthcare providers may order blood tests to measure vitamin D levels, with the most common being the 25-hydroxyvitamin D, 25-OHD. Vitamin D deficiency, management and prevention. Treatment and prevention. Aim to maintain adequate vitamin D levels in the body. Consideration of vitamin D supplements. D2, ergocalciferol from plants, and D3, cholecalciferol from animals. Prescription required for D2. D3 is available over the counter and easier to absorb than D2. Prevention. Age. People over 65 years and infants are at higher risk due to decreased skin's ability to make vitamin D. Skin color. Darker skin is more difficult to absorb vitamin D from sunlight. Mobility. Homebound individuals or those rarely outside are at higher risk due to inability to use sun exposure as a source of vitamin D. Prevention. Ensure adequate vitamin D intake in diet and/or through sun exposure. Excessive sun exposure increases skin cancer risk. Recommended daily amounts vary based on age and life stage. Foods with vitamin D include fatty fish, rainbow trout, beef liver, mushrooms, egg yolks, and cod liver oil. Fortified foods with added vitamin D include cow's milk, soy, almond, oat milk, breakfast cereals, orange juice, and dairy products. Vitamin D is found in many multivitamins and supplements. Vitamin D deficit complications and prognosis. Possible complications include low blood calcium and phosphate levels, rickets, and osteomalacia. Rickets is treatable but can lead to long-term bone damage, and severe cases can cause seizures, heart damage, and death. Rickets is rare in the U.S. due to vitamin D fortified infant formula and cow's milk. Healthcare providers should be consulted if concerns about vitamin D intake or proper body use are raised. Too much vitamin D can lead to hypercalcemia. Symptoms include nausea, increased thirst, urination, poor appetite, constipation, weakness, confusion, ataxia, and dysarthria. It's advised to avoid taking higher than recommended doses of vitamin D and large doses of vitamin A in fish oils.